A lot of times we just think of cardiovascular health. Okay, that's going to help me prevent a heart attack or stroke. No, yes, it does. But this is actually going to improve every aspect of longevity, health, feeling good that people want, right? This is true anti-aging medicine of actually improving nourishment, oxygen into all tissues throughout our body. And a lot of people are missing this glycocalyx, which is so important for our overall health. Welcome back to The Root Cause with Dr. Jake. I'm Dr. Jake Schmutz. I am an integrative doctor and naturopathic physician. And in this podcast, I have real conversations with real people to show you how to heal your body down to the root causes without any harmful drugs or surgery. I'm here today with my co-host and patient, Teresa Marie, to talk about the difference between PWV and glycocalyx as it comes to measuring your cardiovascular age.
With that, let's first talk about what cardiovascular age means and how does that differ from chronological age?
Yeah, so let's first talk about like what is chronological age? Chronological age is just how old you are. You were born and now you're a certain age, right? That's chronological age. But that doesn't necessarily mean your cardiovascular system is that age. And that's what cardiovascular age is what is the health of your heart and your blood vessels compared to others. So you might be 40 years old, but you actually have a heart and blood vessels that are about like a 35-year-old, if it says your cardiovascular age is like 5 years younger, right? So you could actually be a certain age and your cardiovascular system could be a lot younger.
Well, I would like to show off that my Aura says that I am 7 years younger than I am in my cardiovascular age. So I'm very excited about that. I don't know why. Maybe because I'm trying to, get good sleep and not stress so much and eat healthy. But, hopefully we'll be able to unpack some of that when you talk about, how you can improve your cardiovascular age. So with that, then let's move on to our second question. Why do you think cardiovascular age is something that most doctors don't typically address?
That's a good question. Why do most doctors not address cardiovascular age? I think it really goes down to like, what is their approach? Most doctors are practice reactive medicine, meaning a problem happens and then they address it. Most patient doctors don't address it like preventative, right? Or a proactive way of actually addressing health. So they don't really care about your cardiovascular age because they're just going to wait till a plaque forms, or they're going to wait till your cholesterol just gets out of control and they need to address that, or whatever that might be happening. So that's really the main reason there is they're just not really focused on prevention and aren't even trained on what to do to prevent cardiovascular disease or any disease for that matter.
So then it seems to me like what you're saying is cardiovascular age and knowing it, tracking it, identifying what it is a form of prevention. You can use it as a form of prevention.
Yeah, so cardiovascular age is really great on using it as a form of prevention. So some of us have these wearable devices, right? The Apple Watch, the Oura Ring, or whatever, and that could give us some basic information on our cardiovascular age. It's not perfect. It's decent. It could give us some addresses. Okay, I'm doing okay. It doesn't tell us that we're perfect though. And we're talking further on that.
So can someone without a tool like a Whoop or an Oura Ring, any type of tool that can measure some of these numerics that like HRV and PWV and those kinds of things, are there early signs that someone could see that suggest that they do have an older cardiovascular age even without having one of these devices? Or is this something like anybody who they might think that they're Mr. or Mrs. Healthy, oh, I'm doing great. And then they get this ring and they find out, no, I'm not. And they didn't have any symptoms of it. It's kind of a double question there.
Yeah, most of these things, like with cardiovascular age or whatever, or checking your HRV or your PWV, you don't really have a lot of symptoms of it. It's kind of like diabetes, right? You don't have a lot of symptoms that are related to these. It's a low grade, unsymptomatic thing that you experience. Now you can start noticing that your PWV, which is what measures your arterial stiffness, you can start to have symptoms of that because what happens with this is you can start to have higher heart rates. You can start to get high blood pressure. You could possibly start to have more difficulty going up the stairs than it used to be for you. You might start getting a little bit of chest pain. But just because you don't experience these symptoms does not mean that your arteries or veins or microvasculature is healthy, because usually it's asymptomatic.
Well, then I think that jumps into, I think that's a good way to kind of transition into PWV. What actually is this measurement? What does it stand for? And can you go into more depth as to how it actually is assessing your cardiovascular age and function and health?
Yeah, so if you have these biohacking devices or devices that are actually able to track these things, they use these sensors on them that have these PPGs, is what it's called, little light sensors. And it has an algorithm that goes along with it that measures your PWV, your pulse wave velocity, which is the speed of your blood transferring through the blood vessel. And this can tell us about the stiffness of the artery. So if we have a more stiff or rigid artery, you're older, your blood vessels are older. The more pliable they are or more elastic they are, the younger you are. So that's what's being measured by these devices, is just checking directly your stiffness of your arteries. It's not perfect though, because it's not directly checking your PWV. It's using these PPGs to estimate what it is. There are devices that you could go into the doctor and do more detailed PWV, and it directly checks that. But the Oura Ring or whatever does a pretty good job. So you don't absolutely have to go into the doctor's office and spend a lot of money to get your PWV checked.
So then that makes me question for you, Dr. Jake, as a physician who cares very much about getting to the root cause of a lot of health conditions, helping people to be able to find and see signs early on so that they can prevent further problems. And then, of course, getting involved if there's already disease happening. Do you have tools that measure the actual PWV, or do you use something else?
Yeah, do I have a tool that actually checks the PWV? I don't do that a lot in my office, because I do think that these biohacking devices do a decent enough a job, and I don't need to really look at that. I look at other factors. Okay, we see that your cardiovascular age is older than it should be. So you have more rigid arteries than you should have. Okay, that's one piece. But we also, what I like to really look at is all kinds of other laboratory tests or other imaging tests that we do to actually see what's going on. So there's a lot of different things, some basic things. We do a calcium score. We do what's called a TIBC, which is the CT scan, in which we can see the carotid artery. We can actually see the plaque and see changes that are happening in the plaque. Those are great things. Those are more basic things. Cardiologists know about this. But what I do that's more specialized and actually more preventative than this stuff is I actually check your glycocalyx. Probably most of you haven't even heard about this, which is sad and really surprising, especially in the biohacking world now, because it's probably the most important thing we have for actually testing the health of our blood vessels.
I want to make sure and be clear. So glycocalyx is not something that these biohacking tools that a lot of people are wearing measures. This is something that they can only get in a doctor's office like yourself. And you're saying that you think it's even better at measuring cardiovascular age than some of these biohacking tools?
100% better than these biohacking tools. Those biohacking tools are okay. They give you some good information and decent information, but just because you have a cardiovascular age that's 7, like in you, for example, mean that your blood vessels are actually very healthy. It means they're better than some. They're not rigid, they're pliable, but your glycocalyx could be crap. That does, even though bad glycocalyx can cause rigidness of the blood vessel, but you might have good, pliable, elastic blood vessels, but your glycocalyx is horrible.
Okay.
So let's go back a little bit. We're saying this word a lot, glycocalyx, right? What is it, right? What is this glycocalyx? It's this protective armor on your endothelium. And let's go back a little. What is endothelium? That's the inside of the blood vessel. That's where blood transfers through the blood vessel. It's that layer right there. And we have this mucus armor layer that's made up this polysaccharide gel-like substance, brush border substance that's on the blood vessel. And when you look at it microscopically, it looks a lot like the brush border of your intestines, like the microvilli. And it's interesting that they look so similar there. So it helps with absorption, but that's in the gut. But in the glycocalyx of the blood vessel, actually keeps things out of the blood vessel. So it's a protective barrier. So you could probably imagine if we damage that shield, we break down that wall, and now we don't have that protection anymore. All these toxins, all these inflammatory molecules, all these infections, etc., are going to inflame the blood vessel. And that inflammation of the blood vessel is what leads to plaque formation, and that can lead to a heart attack or stroke. But also,
Okay.
what I love to talk about even more about the glycocalyx is actually the microvasculature, which is the capillaries. So not just the large vessels and the big vessels. We do have tests that check certain things like that, not the glycocalyx, but the large and small vessels, you're like checking your cholesterol, you're checking your CT scan, then I talked about calcium score, etc. But the glycocalyx will test those, the big vessels, but it's also testing the small capillaries. And what's the key here is this is so important for your just general health, not just your cardiovascular health, not just preventing heart attacks or strokes. It's actually improving health all over. So the capillaries is what delivers nutrients and oxygen to every organ to your body, the brain, the heart, the gut, the kidneys, etc. So if you have this glycocalyx that's being damaged, the capillaries then start getting destroyed and killed, and they aren't functioning very well now. And now your body's not getting good oxygen and nutrients. So you feel yucky. Your brain doesn't work well. You get brain fog. You can't think very well. You get dementia later in life. You have low energy, focus, and concentration. You can't exercise very well. That's all related to damage to the capillaries through the glycocalyx. So it has so much to do with our overall health.
Okay, you've said so many things that I'm like, I am so excited. I'm like, okay, I understand. Okay, so I want to make sure that everyone understands that's listening, and I want to make sure that I'm understanding. I loved, first of all, that you compared it to the gut, because when you were first talking about it, I'm like, okay, this reminds me of the gut. So, a lot of us, the gut health thing has been going on for many years, right? Now, this cardiovascular age is kind of the new thing that's coming in. But similarly to gut health, right? If you are not taking care of your gut, the lining of it can start to get damaged. And then we get this term leaky gut, right? And it causes
Mhm.
all sorts of problems because it gets toxins into our bodies, and because it bypasses that layer and now it's into our body, right? Like our intestines are a tube that's basically trying to protect it, like lets the good guys in, and it's supposed to keep the bad guys out into entering our bloodstream and our tissues and so forth. So this makes sense to me that in our veins we have something similar, and we have this protective layer. And if it's not there and it gets damaged, right, now we can start really causing some problems. One of the problems being that you referenced is, we hear about cholesterol, right? Oh, cholesterol is bad, cholesterol is good. A lot of different thoughts on it, but one of the purposes of cholesterol is when it sees damage in the veins, it goes over to that part of the vein, and it starts to collect there to help heal it. The problem, though, is that when it's all collecting there, if the vein is now swollen as well because of cardiovascular and damage, now you are more likely to have a blockage, and that can lead to a heart attack. So we want to reduce the swelling of the veins, and we obviously want healthy veins so that our cholesterol doesn't need to, stay stuck there. It can do its job, it can get out of there, and we're done. Third thing that I'm hearing that you're mentioning is the capillaries. The way that I see it, Dr. Jake, and tell me if I'm wrong, is I kind of think of it as like we have our arteries, we have our veins, and then we have our capillaries. The arteries kind of do
Mhm.
the big job, right? Heart, body kind of a thing. Veins kind of getting everything to the right places. And then the capillaries are like getting the blood with all of the nutrients, all of the things that we need into our tissues. And that's where, that's what actually is doing the work that helps us feel good is our tissues. There's tissues in our brain, there's tissues in our heart, there's tissues in our eyes, there's tissues everywhere. If we don't have the capillaries getting the nutrients into our tissues, we're going to feel the big symptoms. And so, not only protecting our arteries and our veins, but actually protecting the capillaries that are getting those nutrients into our tissues so that we can feel good is really, really important. And I never have thought, Dr. Jake, about how my cardiovascular health could actually be affecting whether or not my brain is getting the right nutrients into it. This is huge for me listening to it. Am I on the right track with understanding
Perfect.
what you're saying here?
Yeah, it's perfect. Yeah, that's exactly it. It affects every aspect of our health. A lot of times we just think of cardiovascular health. Okay, that's going to help me prevent a heart attack or stroke. No, yes, it does. But this is actually going to improve every aspect of longevity, health, feeling good that people want, right? This is true anti-aging medicine of actually improving nourishment, oxygen into all tissues throughout our body. And a lot of people are missing this glycocalyx, which is so important for our overall health.
Okay, I have one more question about glycocalyx, and then I want to move on to another like term we often hear, a measurement that we often hear when it comes to these biohacking devices and cardiovascular health. And so I can understand, we can all understand the difference. One, um, if somebody goes into your office and finds out that their glycocalyx is not doing well, the numbers are showing poor glycocalyx.
Mm-hmm.
If I were to find out that my gut lining was a problem, I would need to go on a special leaky gut type of diet. I would need to take some certain supplements to help heal that lining, and then eventually I would start seeing my symptoms go away. In this case of glycocalyx, what would you do if someone came in and they learned that their glycocalyx was not optimal?
Yeah. So, what do we actually do to identify a glycocalyx issue? We have this specialized microscope that you place right underneath your tongue. We have our superficial blood vessels right there. We have big blood vessels and small ones. We have our arteries, our veins, and we also have our capillaries right there. So we put the microscope in there, and actually in real time, we take a video of the blood flow going through there. And we're actually doing a measurement, which is going to tell us the health of that glycocalyx. And after that, we could get that quite quickly. And we're actually able to discuss, okay, what's your score of your glycocalyx? Is it healthy? Is it not? Do you need to do anything about it? And then we're like, okay, now we need to do something. Let's talk about what we need to do. So, yeah, there's specialized diets that we need to follow. Like what's usually been shown to help with the glycocalyx is the Mediterranean diet. Usually not the only thing that needs to be done, but the Mediterranean diet is very important on helping the health of the glycocalyx. And then we also we also want to live a non-toxic lifestyle, like decreasing all the toxins that are coming into us, like the pesticides, the herbicides, solvents, all that stuff, because that's one of the biggest reasons that we have a weak glycocalyx is because of that. So that's a piece. And then there's certain nutrients that we take. And the best one and what has the most research is picoidin. That's a weird word,
Can you spell
picoidin.
it?
It comes from brown seaweed. It's Fucoidan. And that is a substance that has the most research to help rebuild the glycocalyx. Also, hyaluronic acid. All of us have heard of hyaluronic acid, especially women, to help replenish the skin. But a lot of what the glycocalyx is made up of is hyaluronic acid. You want a high molecular weight hyaluronic acid. And then we also want antioxidants, strong antioxidants like resveratrol or berries. These type of things have a lot of research to help rebuild the glycocalyx also.
Excellent. Well, and I know that you're gonna be digging much further into this for anybody who really wants to geek out on this particular measurement tool in another episode. Well, Dr. Jake, this has been so empowering to be able to know what these numbers mean on our rings, and also to be able to how to go and get extra information so that we can actually get on top of this. Now, my last question really deals with somebody who might be nervous. Going into a doctor's office, getting a test like a glycocalyx, for example, and maybe being afraid, like, what am I going to find out? What if I find out that my cardiovascular age is that of a 70-year-old when I'm actually 40? Like, that's scary. I don't want to know that. What would you
Yeah.
say to a patient who might be feeling those things and a little apprehensive about actually finding out, what is my PWV? Should I get an Oura Ring? What is my HRV? Should I get a whoop? Should I go to the doctor's office and get my glycocalyx checked? What would you say to that person?
It's kind of like this idea that ignorance is bliss. And I hate that term because it's like, okay, you just don't know stuff. So you're just going to die. Just crap is going to happen because you just don't know anything and you have a happy life. Okay. Yeah. Maybe you have a happy life, but then it was prevented all this crap that could have happened in your life. if you're actually not ignorant about it, right? So it's that type of idea. Knowledge is king. You know, okay, you might find out that you have an issue going on, but you would rather not find out what's going on and then you have a heart attack or stroke in 5 years, or you're able to actually find out what's going on and you're actually able to do some prevention. Because everything that I'm going to be testing in my office is we're going to actually be able to identify what's going on, identify the cause, eliminate that cause, and treat it effectively so that doesn't happen in the future. Okay, you have cardiovascular age of 70. We could bring that back to your normal age. So that's pretty empowering, right? That we can actually fix the issue, make you healthier so you're not going to have that heart attack or stroke. You're not going to have dementia when you're older, or you're not going to have chronic fatigue syndrome or whatever that can happen from our cardiovascular system not working appropriately.
Well, I'm certainly inspired to be able to get in there, Dr. Jake, and have my glycocalyx checked. And then now to start seeing, okay, what happens when I go do some exercise? What can I see happen to my HRV? And just start playing with some of those lifestyle changes to see if I can start changing my numbers and improving them. So for people who want to be able to get a hold of Dr. Jake and possibly get one of these tests done, or anything else related to their health that is concerning them at this time, you guys can get a hold of Dr. Jake by visiting and clicking the link down below, which is drjakewellness.com/schedule. And you'll be able to schedule an appointment with him there. He does both virtual as well as in-person appointments. So it doesn't matter where you live, you can definitely get Dr. Jake's expertise. You can also give him a call at 801-676-9876.
If you want to learn more about cardiovascular age, like your heart rate variability or your PWV, and you're watching YouTube, you could click my video to the right. I'm Dr. Jake, and I'll see you there.